Hello and welcome. Happy Wednesday. Thank you all for joining us today. We'll get started in just a moment here. Thank you again for joining us for today's webinar. I am Julie Matusik, and I'll be moderating today's webinar, which is the Network Spotlight on the Minnesota Network. So we are so excited that you're here. And before we dive in, want to go over a couple of housekeeping items for you. And so I'll be moderating, as I said. If you are joining us online, you can listen directly through your computer's speakers. If you joined via the phone number that Zoom provided, your line has been muted to minimize background noise. For those of you that are online, we encourage you to click on the link here in a moment. There'll be a link where you can access the handouts to today's webinar. It's a Dropbox link. And if you're not able to access it, we will be posting those to the website tomorrow. So you'll still be able to access those. We also can email them to you as well. You also want to note that you can enter questions into the Q&A portion of the Zoom webinar platform. So you'll see where it says Q&A, and that's where we'll invite you to enter questions. Please enter those in as you're thinking of them so you don't forget them. We also have the chat portion of the webinar here. So if you click on chat, you will be able to, you can chat with everyone. You also can private message our live tech support that we have here today. Katie is on with us, and she'll be able to help troubleshoot if you run into any issues at all with technology. And we'll also cover questions at the end of the webinar. And if we're unable to get to all of the questions, someone from the NFSN will follow up with you after the webinar. And last thing, today's PowerPoint, the handouts, and a recording of this webinar will be available by this time tomorrow on the NFSN website. When you exit the webinar today, an evaluation will automatically appear on your screen. So we ask that you take a moment to complete this, as it provides really helpful and valuable feedback that informs future webinars. So thank you in advance for that. Well, we'd love to get to know a little bit about who is here today. So let's take a peek at this map, and we can see geographically where everyone is joining from. So Katie's going to launch a poll here in just a moment where we will ask you to weigh in and share which region of the United States you're joining from, or if you are joining from outside of the states. All right, take one last moment, and then we'll take a look at those results. Okay, looks like about half of the folks are from the Midwest. Great, but we also have representation from all other three of the areas of the United States. So that is just wonderful. Thank you all so much for responding to that. That's really helpful to know. And then we have just two other polls we're going to launch. I think this next one is about our affiliation. So do you represent a family resource center or a family resource center network level? Maybe you work for another family support program or a parent leader or in early care and education. There's education. We have a couple different categories for government, or if you're a private funder. And if you put other, just let us know in the chat what your affiliation is, just so we have an idea of who's here today. All right, let's take a peek at those results. Okay, all right, great. Wonderful diversity here with many of these areas represented. I know you'll all find today very helpful as you look at it through your various lenses. All right, and we have one other question that we're going to launch here. And this question is about about family resource centers. So does your state have programs that look like family resource centers? And we'll be talking more about family resource centers in just a minute. So take just a moment. So let us know yes, no, or if you're not sure, that's completely okay too. And hopefully in a couple slides here, you'll be able to be a little bit more clear on just what family resource centers look like if you're not as sure. All right, let's see those results. Okay, that's exciting. Yeah, so everybody that weighed in said that they do. So that's really great. Well, thank you all so much for participating in those polls. Want to share a bit of contextual information and then really excited to hand things over to the reason you all are here today, which is to hear from the Minnesota Network. So I work for the National Family Support Network, and just a little bit about us. We started as in 2011 as a volunteer network that we had 8 states were part of that um, original network. And since then, we've more than quadrupled in size. So we now have 41 member networks that represent more than 3,000 family resource centers that serve more than 2 million people annually. A couple of our newer members that joined are Iowa and Nebraska and Wyoming have all joined recently. So these are popping up in the Midwest. And so stay tuned with this map. It's just really exciting to see it grow. The mission of the National Family Support Network is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. And our vision, in short, is that the map that you just saw, that whole map would be green, ensuring that all families across the country have access to quality family support programs in their very own communities that are supported by the networks of in their state. Let's see. Okay. And let's see. All right, so let's take a look at our overview. And this is our roadmap for today. This is what we'll be covering network. We'll share a couple of resources and opportunities with you that we hope will be helpful for you. And we'll close with that evaluation. All right, so just as a little bit of context setting, the family resource centers, just want to make sure we're all familiar with them and working off the same kind of definition. Thousands of family resource centers have emerged organically across the country, yet their existence is still largely under the radar as what we sometimes call America's best kept secret. Working on every day, making it not America's best kept secret. And thank you for being here today to help spread the word. But so these family resource centers, they are community or school-based welcoming hubs of support, services, and opportunities that are designed to support families to be strong and to be successful. They may be community-based, like the image on the left of a family resource center in Vermont. And then they may be school-based, like the image you see on the right in Kentucky. So that's family resource centers in 30 seconds. But now we'll look at how those family resource center networks are connected. So not only have cities and counties and states hit upon the value of family resource centers themselves, but they also have hit upon the value of networking them together. And so family resource center networks, they consist of 2 or more family resource centers. They ensure the coordinated quality support for families, and they serve as the backbone entity to leverage and coordinate the collective impact for their members. And the structure of these varies from network to network. We'll get to hear all about Minnesota's today. But these networks, they may be independent nonprofits coordinated by a public or private funder, or they may be led by FRC directors themselves serving in a volunteer leadership capacity. When we're talking about family resource centers, all of them look a little bit different just because, similar to FRCs, all of those look a little bit different because they're serving their unique geographic area. But we do see, despite their organic development, the most common functions of them from across the country. So this comes to us from a national study that the NFSN worked with a research institute on in Colorado. So the first is increasing the connectedness, coordination, cooperation, and collaboration amongst their members. They also often provide training and technical assistance. They also frequently work on advocacy, policy, and legislation. And Family Resource Center networks also frequently provide and maintain a shared data tracking system. So not all networks do all of these things, but these are the most common most common functions of those FRC networks. Another way we talk about networks is their stage of development. This is kind of how long they've been around and what they're up to at each of these various stages. So the first one is emerging. This is kind of that birth to 3 years when the network is just getting started. They're determining who will be at the table, what they want to focus on. And then as they continue along this continuum, they then would evolve into the evolving network. So this is that 3 to 5 years of development. And so this stage is where they're often hiring contractors or hiring their first staff. And the networks really begin to have more structure and capacity to do more. And then we would consider networks to be an established network once they've been around for around 5 years. This is when they typically have staffing and a track record of activities. One interesting characteristic of these networks is that they have weathered crises and they've decided to stick together. And this next slide here is about the different types of network. I mentioned it a couple of slides ago with all of the networks looking a bit differently depending on the type. So I'll just talk a little bit about each of these just so you're familiar with these different types. So one type of network is an independent network. So this is a staffed, independent nonprofit organization that functions as a membership alliance. And so members, they may pay dues here. And these networks may raise or distribute funds. So they may function as an intermediary or they may not. So a couple examples of this are Colorado and Maryland. The next one we'll talk about is the volunteer coordinated networks. So these are led by FRC directors themselves in a voluntary leadership capacity. So they don't have any paid staff. They're doing all of this on top of their full-time roles at their centers. New Hampshire and West Virginia are examples of this. And then we have funder coordinated networks. This is where the network is led by a public department or a foundation that both funds and convenes the centers. So New York and Nevada are two examples of this type. And then the last one, this is a nonprofit coordinated network. So this is our newest one to this slide. This one kind of emerged organically out of realizing like, oh, all of these different networks are not quite fitting into these other three, and we needed to create a new category. So this one is where there's a nonprofit entity that coordinates the network by providing the backbone support with dedicated staffing. The nonprofit entity itself is not the network in this case. The nonprofit, they may incubate the network to spin off in the future, or they may continue to coordinate it. It just depends. Hawaii is an example of this, which began as a volunteer-led network for the first 2 years and is now most closely aligned to this nonprofit coordinated type. So all that just to share a bit of context before we dive in and have the opportunity to hear from the Minnesota network. Hopefully you'll find it helpful. And without further ado, I'm very excited to pass the baton to Brenda, who will kick us off from the Minnesota network. And you'll get a chance to hear from Angie, Suzanne, and Colleen as well today. So over to you, Brenda. Thank you so much for being here.
Great. Thank you so much, Julie. Greetings from Minnesota Makoche, or the land where the water reflects the skies. Our land was named by the Dakota, who along with the Anishinaabe are the indigenous people of the land now known as Minnesota. My name is Brenda Mahoney, and I have the privilege of being the project coordinator for the Minnesota Community and Family Resource Network, working for the Association of Minnesota Counties. We wanted to just start with a few fun facts about Minnesota. Minnesota is known as the land of 10,000 lakes. Really, it's more than 14,000 lakes. And we have over 69,200 miles of rivers and streams. That's enough to circle the world 2 3/4 times. Minnesota has a large metro area in the Twin Cities of St. Paul and Minneapolis, as well as large hubs including Duluth along the Lake Superior and Rochester, the home of the Mayo Hospital. These are surrounded by very rural areas of farmland, prairies, and forests. We also have what we refer to as the frontier areas up in northwest Minnesota, which is bordered by North Dakota and Canada, and the Iron Range, which is the northeastern Arrowhead area of Minnesota up by Lake Superior. Minnesota takes some pride in being a home of some ingenuity. The first successful open heart surgery happened in Minnesota in the 1950s. It's also the home of Scotch tape, the bunt pan, rollerblades, Milky Way candy bars, and water skiing, which were all invented in Minnesota. Go ahead. A little bit about the people in Minnesota. 64% of the people in Minnesota live in the greater Twin Cities multi-county area. While the greatest diversity is in the metro area, there are growing diversity across the state, and there's been a 36% increase in the Black or African American population in the last decade. There's also growing immigrant communities, especially in our Hispanic communities in the more rural areas, the Hmong community in the metro, and Somalian and other Northeast African immigrants in the central part of Minnesota, the southeastern corner, and the metro areas. There's also vibrant Native American communities of Dakota and Anishinaabe, both surrounding the 11 tribal nations and the urban Native communities. Go ahead. Minnesota has a long history of family resource center type programs, some in existence since the settlement house days and having endured and served families for well over 100 years. Funding and support of these programs has come and gone over the years. The start of the Family Resource Center movement in Minnesota using the NFSN model has been led by counties and their community partners with collaboration with our state departments around family serving programs. The state initiated community hubs in 2019, which you'll hear more about later. This was a bit of proof of concept on the value and need for more family empowerment and support services. Counties have brought this forward by investing in the FRC model. So a bit about what makes Minnesota unique in the area of human services. We are a state supervised and county administered state. That means that the policies, monitoring, and guidance is at the state department level, but the provision of services to families is through each of the local county human service agencies in our 87 counties and with our 11 sovereign tribes. At the state level, the Department of Human Services covers all the human service areas, social services, financial services, Medicaid programs. But as of July 1st, we have a new Department of Child, Youth, and Family that will now house the child welfare areas, some 0 to 5 services from the Department of Education, and some prevention services from the juvenile justice area of public safety. So we're in a little bit of transition right now and moving forward with some of that. All the counties and their county commissioners belong to what we call the Association of Minnesota Counties. Under this, there are several other associations, one of which is MACSA, the Minnesota Association of County Social Service Administrators. This is the home of our emerging network and is the umbrella for our network. Go ahead, Julie. I love this slide and this quote. There comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. So you may be wondering what that has to do with Minnesota FRCs and our FRC network development. This quote really says it well. For years, we've talked about how can child welfare move upstream in prevention. That's really difficult when the counties by statute work in the deep end services. FRCs provide an opportunity for government to work alongside communities with input from families instead of just leading the work. It provides a chance to support communities to take the lead and thus move further upstream. Because of this, counties and their boards of county commissioners are seeing FRCs as a model that can address the barriers and challenges families may face, with issues such as lack of housing, transportation, food, childcare, and other concrete supports, often resulting in reports of neglect to the local county human services departments. We see FRCs as an avenue to partner with communities to meet those needs before a crisis occurs. Go ahead. So, to summarize quickly, why are AMC and the counties invested in this? First of all, to minimize deep end county programs. FRCs fit with the goals of counties to decrease child maltreatment, to decrease out-of-home placements, and to address the disparities that we see in our system. Second, a belief that government can't and shouldn't do it all. Families and communities need choices that best meet their needs in order to be successful, and we see that working together with the communities and with our families through the FRC models is a way to do this. And lastly, doing the same thing and expecting different results has often been called the definition of insanity. We have tried for years to get different results by doing just more of the same. And I can say that I was one of that, and part of it, I worked in county human services for 36 years, and we always had this dream of what can we do differently to really move upstream. Well, now it's the time through FRCs and their work doing that we think it's time to better listen to and work with our communities and families and to make that happen. Right. So this slide shows our goals of today's webinar. We want to talk about our journey, talk about the gift of a philanthropic partnership, give you some information on our network development, talk about our state partnership, and then end with our best hopes for the future. And with that, I'm going to turn it over to Suzanne Arntzen, and she will introduce herself and we'll talk about the start of our journey in Minnesota with the work that occurred in Scott County.
Thanks, Brenda. Good afternoon. As Brenda said, I am Suzanne Arntzen, Deputy Director with Scott County Health and Human Services, and here to share a little bit about the journey that Scott County has been on as it relates to Family Resource Center and overall prevention, along with our statewide work in building out family resource centers across the state. So as you can see, Minnesota here, this is the map of Minnesota with the red being Scott County. So just to provide some context, Scott County is part of the Twin Cities metro area. Although I will say we are clearly a outer tier or suburban metro county. We hold some of the things that I think make Scott County unique are around, we have this mix of urban, suburban, and rural. And so many community members talk about it of having this small town feel and really a desire to hold on to that despite rapid growth in our population. So through the early 2000s, mid 2000s, we've had rapid population growth, both in numbers as well as rich diversity. As Brenda already mentioned, we have growing diversity across the state, and Scott County is also a part of that, where we have increasing in immigrant populations, East African, Ukrainian, Russian, and then we also have strong partnerships. And really, I want to pay our respects to our Mdewakanton Sioux community, where we essentially occupy land in partnership with our tribal partners who are part of our county network. We can go to the next slide. So how did we start? I'm going to take you back. So this slide talks about 2017. 2 years before that, the state of Minnesota experienced a governor's task force on child protection following a high-profile child fatality. And what we started experiencing from about 2015 or 2016 in Scott County and across the state was a rapid increase in the number of child protection reports, child protection assessments and investigations, and rising numbers of out-of-home placement. Equally concerning, specific to Scott County, with a number of children 0 to 5 who were not only entering placement, but were going to permanency away from their families. So as we engaged our board around the concerning trends that we were experiencing within child protection or child welfare, our board was also engaged in an overall strategic planning endeavor. And as a result of that, our board leadership, they established a board goal around ending the need for child protection, that we had to find something different and better to help families and children to thrive. That launched our springboard to child welfare and our public health department partnering together on an initiative to really engage our community. And so starting in November of 2017, we held a series of community conversations to hear directly from community members. Well, first I'll say to share the data that we were seeing and then get feedback from community members about both what was strong and supportive to children and families in the community, as well as what gaps and challenges were present. You can go to the next slide. The work of the community engagement really helped us formalize a strategic plan focused on ending the need for child protection or ending the need for child abuse and neglect. So that feedback was formalized into the strategic plan. And then we had a conversation about how do we operationalize that plan? Because we heard loud and clear from families and community that the worry was we were going to start the conversation and then would we ever see it go anywhere? So as a result of, again, that feedback, we formalized what we now call Together We Can. And the We Can is around work to end child abuse and neglect as a community-driven Scott County community members coming together as a think tank to identify upstream prevention resourcing. We can go to the next slide. As part of the Together We Can work, it was formalized as a steering committee, which again included community members, Scott County staff. We had members of the judicial branch involved, all coming together around a mission that they identified, which was, how do we end child abuse and neglect within a generation in Scott County? There were subcommittees, one specific subcommittee, which was the Whole Family Committee, focused on researching and identifying whole family strategies that would be strong and supportive to families in the community, to get families what they need at the earliest point possible. And probably to no one's surprise, that committee identified family resource centers. I'm going to share a brief story. Some may have heard this before, but as we did our community engagement and we talked to families around what they needed from the community, I also had the opportunity to talk to 3 young Hispanic moms who approached me after one of our community conversations to say how they wanted to parent their children differently than what they experienced, and also how difficult it was to be a parent of young children and to be poor. One mom very passionately talked about the challenges of having to walk 2 miles in one direction to get access to economic benefits and 3 miles a different direction to get access to school support services for her child. And her friend then says very innocently, isn't there one place that we can go so families can get what they need? And we didn't know it then, but certainly that has become the evolution that we now know as the implementation of our family resource centers. We are excited and really proud of the fact that in August of 21, we launched 3 family resource center sites, all co-located, one in a library, one in a local food shelf, and one in a YMCA. And the work continued to grow, the energy continued to grow. And now we have a freestanding family resource center that we launched in March of 23, and 3 additional what we call family resource center satellite that are really designed, again, to help get families what they need and a service access at the earliest point possible. Next slide. So again, just to frame up a little bit, this is sort of a guiding North Star for us in that it represents a continuum of where we've been and where we want to go. So on the right side, you'll see child protection, really the deepest. This could be child protection, it could be corrections, it could be incarceration, but it represents the deepest end of the system and where we want to move to, which is the far left of how are we ending child abuse and neglect and supporting and strengthening families differently and better at the earliest point possible. Next slide. And this is probably the most exciting part of the work. These pictures just simply represent a small sliver of some of the activities and partners that we have working out of our family resource centers. The picture that I am most proud about, that I do want to take a minute to talk about, is the picture on the top left, the young woman in front of the microphone. That is one of our Parent Advisory Council members who spoke about a year ago at the Association of Minnesota Counties, which is a group of county commissioners across the state. And as she spoke to the hundreds of county commissioners in that room, you could have heard a pin drop. And what I can say that really emphasizes the importance of parent voice in helping to guide, shape, and move this work. Following that conference, the energy and interest by county commissioners in seeing a different way and a different opportunity to serve families has just continued to grow at, I want to say alarming, but exciting rates. And that is really, I think, the evolution that has brought us here today to the Minnesota NFSN Spotlight. So with that, I have the honor and privilege of really turning over to Colleen O'Keefe, Executive Director with the Sauer Foundation, who has just been an instrumental partner both in Scott County and statewide.
Thanks, Suzanne, and thanks everybody for being with us today. I am here to talk about the philanthropic piece, and it has been the Sauer Family Foundation and also Casey Family Programs working on family resource centers in Minnesota. The Sauer Family Foundation is a grant-making organization, and we're located in St. Paul, and we support work with children and youth and families statewide. On the next slide, you'll see the mission for both of our foundations, so you can see why this work fits for us and for Casey Family Programs. We've been working, the Sauer Family Foundation has been working in many different funding areas over 27 years, but we've been working to help improve our child welfare system for the past 10 years. Casey Family Programs is a national operating foundation with headquarters in Seattle and strategic consultants in all 50 states. Mike Shull is our strategic consultant in Minnesota, and he's interested in building out a service array for families that precludes the need for a child protection response. FRCs are a wonderful vehicle for that, especially when concrete supports and navigation for families are included. So both of our foundations are working to transform child welfare, but also working on how to support families earlier. We understand that some families are landing in child welfare for reasons of poverty, and although Minnesota's support for families is strong, it's not as well aligned and accessible as we'd like it to be. When Suzanne came to us with the idea of family resource centers, we liked this framework, this national model. We liked the 5 protective factors to strengthen families, the quality standards, and the Parent Advisory Council's leadership. We support this community-based approach, and we believe it will reduce caseloads in child protection so that only the cases where there are true safety concerns enter child protection services. But mostly we see promise in a high-quality, family-friendly, non-governmental organization for families to go to for resources. Next slide, please. Both Casey and Sauer brought funding early to Scott County for FRCs. Mike brings technical assistance and national knowledge of prevention services. The Sauer Family Foundation funded Brenda's position at the Association of Minnesota Counties to support the work in the counties and connect them to NFSN. She's been very busy, as you will soon learn. There are two direct funding opportunities through us for family resource centers. The first one is we call Explore and Assess, and it's to support a collaboration of family-serving organizations to work with their counties to assess the current family resources and particularly how the protective factors are showing up in community, and also to recognize any gaps. These applications come from whoever is the lead organization for the work. It can be a county or tribe or their nominated community partner. So far, besides the counties, we've seen a community action partnership agency, a family service collaborative, or nonprofit organizations that have been serving families for years. This work has been exciting for us because before applying for the development round of funding, we get the report, and then we also get to see the assessments. In the assessments, we've seen a thorough, thoughtful approach to collaborating with the organizations that already exist and are currently serving families, and where the gaps are in the county for serving the needs of families. We see county staff becoming aware of newer organizations that they may not have known about, or programs like full-service community schools that are funded through the Department of Education. It's so important to honor the organizations that already exist. This work is grounded in two key values: being asset-based and raising up community voice. We also see organizations working with their counties as partners in this work. We've had leaders from nonprofits tell us about their experience being part of the assessment and the excitement and cohesion that it's generating. So far, people have been really excited about this work in their counties. The second opportunity for funding we call development, and for us, it's about helping them develop FRC elements in the identified gaps. We are unable to fund things like concrete supports, but we can fund things like creating a parent advisory council, hiring lead staff from the community, and NFSN training. And so far, it's been mostly the standards of quality and parent advisory trainings that we've funded. If you're going to work with a private funder, it's important to talk about what they can and cannot fund. We've been focused on what we can support, and we've been clear that we cannot sustain family resource centers over time. Philanthropy has hardly ever sustained things over a long period of time due to changes to our boards. And for example, in Minnesota, all of the funds in philanthropy here is about 5% of government funds. So that's why we believe strongly that we can help organizations start something or make changes or add pieces of work, but it's the government's role to sustain evidence-based models that have proven to serve families better and save money from the back-end government services. Next slide. Since 2021, we've given over $4 million to help with the work of family resource centers in Minnesota, covering 27 counties and around 60% of the population here. You can see on this map that we use to track our work that counties are in various stages of the process. The star represents where the Twin Cities of St. Paul and Minneapolis are. And so we have our grant deadline. Our next grant deadline is the end of September. And so FRC inquiry is when people are talking to us about applying. And as people are coming back from vacations now, we already have more people calling. They just haven't made it on the map yet. And then the orange is explore and assess. So they're doing the assessments, and then development. And then the blue is where FRCs are open. Next slide, please. So I've talked about why this is important to both Casey Family Programs and the Sauer Family Foundation. But just to summarize, we believe that child well-being is dependent on being in a family that is with a strong support system around it. And families are the building blocks of thriving communities, and successful communities support their families. Our hope, and I'm speaking on behalf of Mike at Casey and myself, our hope is that the assessments can help counties stay connected to community partners that are serving families well. And families in Minnesota can enter a family-friendly place and get the help they need in a respectful way. And now I'm going to turn it over back to Brenda, who will talk about her work.
Thank you, Colleen. So as you heard, the network started due to the interest of the Association of Minnesota Counties, where the county commissioners made FRCs part of their Health and Human Services legislative platform for 2023. And it truly began through partnership and support of Casey Family Programs and Sauer Family Foundation, and their investment in the same long-term goals as where the counties were talking. Sauer Family Foundation, I can't say enough about. They're not just a funder. They're a true partner in thinking through the needs of the state, providing assistance, support, and collaboration. Go ahead. Oh, one more. Okay. For the sake of time, I'm not going to go through everything on this slide, but I believe this will be available. It gives a timeline of the work in Minnesota by counties and their communities. Suzanne covered 2017 through 2021, which was really where it was beginning with all the work happening in Scott County. In late 2022, Sauer Family Foundation funded AMC to develop the network, as you heard from Colleen, and to support interest in FRCs. And with that grant, the goal was to provide technical assistance, training, policy development, and advocacy for sustainability. At that time, they also funded 4 additional counties to pursue this work. In 2023, 2 counties, Pine and Polk, each opened Family Resource Center locations, and a dozen additional counties and their partners entered this work. Work by counties through AMC with the Department of Human Services and the Children's Cabinet led to the Community Resource Center legislation I mentioned earlier, and that will be talked about again a little bit later. In 2024, the number of projects has grown to 27 counties with their partners. And as Colleen just said, and I was excited to hear, there's been more inquiries yet coming for that fall round of grants. And I need to just mention, initially when we started this, our goal for the network was to have 3 counties that would be joining in on this work. We're now at 27 18 months later. So kudos to all the counties and the work that they're doing at the local level with their communities. Go ahead. This slide talks about the network vision and mission. The leads of the initial counties that engage in this work were recruited to be our initial implementation steering work group for the network. Along with partners for all the projects, the above mission and vision was developed. There's a focus on building of protective factors that is reflected in our mission statement, and also about honoring the voices of families and the communities. Go ahead. Together with our partners at Casey and Sauer Family Foundation, the network membership based the network framework on the 3 pillars shown in this slide, very similar to what's happening with other FRC networks. We set these as expectations for the FRCs from the very beginning. First, that services need to be centered around the evidence-based 5 protective factors. Scott County really was our standard, looking at what they were doing within the FRCs being lifted up there, as well as we have to give a lot of credit to other states who allowed us to come and visit, especially Wisconsin. We had an opportunity to visit and see what was happening there and to build our network off of what has already been done elsewhere. The second pillar is the standards of quality, identified and developed by the FRCs and NFSN over the years, and we're using that to provide a clear language and understanding for all service providers, staff, and families. Our initial 3 counties with FRCs are completing their first self-assessments using the standards of quality. And then lastly, the essential component of having a parent advisory committee to ensure parent engagement, partnership, and commitment to providing services in a manner the community identifies as culturally appropriate and acceptable. And I want to mention the State Community Resource Center work is also looking at the protective factors as being foundational. There's interest in the standards of quality, and some of the state leads have been invited to attend training. Parent voice is also being supported at a state level through involvement of parents on the State Advisory Committee. Go ahead. So a little bit more about what have we done. As we mentioned in the beginning, the projects were started through the counties and the community partners. And I think the clean hit on this, that in several communities, counties are leading or co-leading, and there's been more involvement of other entities such as family service collaboratives, community action programs, and nonprofits taking some of the lead. That's really our goal. We want to see this be community-led and community-driven. Technical assistance from NFSN has been critical in our developing network. Andrew Russo initially provided this and then matched us with Lisa Morell as a consultant who has helped us over the last 18 months. Lisa has been wonderful to work with. I don't know how I would have been able to do some of the things and how our network would have been able to do this without having Lisa there for support. And she's always ready for me to give her a call to say, what do we do with this question? Some of the things that we've been using the TA for is a 4-part foundation series for new projects, pre-implementation and implementation phase technical assistance on a regular basis. Lisa provides some network consultation, as I mentioned, always ready to be there if we have questions, and then opportunities for individual project technical assistance sessions. So if a project gets stuck or has some questions, she makes that available to us to just talk about whatever that issue may be. Recently, we've developed committees to help with our growth. None of this could be done without the commitment of the members and the time volunteered. It's the work at the local level that's making this work grow and is building our network. One example of committee work is the Information Portal Committee. There's been a lot of requests for documents, and being in a part-time capacity trying to get those out timely has sometimes been a challenge. So we've developed a portal, which is currently located at the Sauer Family Foundation website and has both a public-facing and a member-only document area, very similar to the NFSN portal that's been developed. Go ahead. As a network, we continue to work to not only support one another on our FRC projects, but also to align work with our state partners and develop a clear vision for family resource centers across Minnesota and for long-term fiscal sustainability. It's our belief that, like many other states, investing in upfront prevention work using a community-based, parent-driven model can help Minnesota address the high numbers of children in child protection and out-of-home placement, especially where disparities are the greatest. By starting this work with counties, there's opportunity to shift savings in deep end services such as child protection and placements to prevention services as one potential funding avenue. We recognize that it will take greater sustainable funding to lift this work up to its full potential in Minnesota, and we're learning from many other networks about the braiding of those funds and trying to work on that with our state partners. To help assure the fidelity and expand the understanding of the work of family resource centers, this year we've hosted 3 standards of quality trainings, and we currently have 4 of our members who are in the process of becoming trainers to help with our long-term training plan. So that's just a little bit about what the network's been up to in the last 18 months and where we hope to be going. And with that, I'm going to turn it over to Angie Teese, who is going to talk about the future of FRCs.
Good afternoon, everyone, and it's a pleasure to be with you. My name is Angie Teese, and I am the Child Wellbeing Policy Analyst for the Association of Minnesota Counties. And what you see before you here today are the 4 leaders that have made this work in the state of Minnesota from a county-based perspective with strong philanthropic support. And so my piece of this really is the policy and the strategy and aligning and beginning to shift kind of our systems. So I will touch on kind of the infrastructure of that policy and at the state level that we're working within. So maybe go to the next slide, please. So building off of the success in Scott County and the tremendous philanthropic support of the Sauer Family Foundation and the partnership of Casey Family Programs, as Brenda indicated, we secured foundational support to bring Brenda on and to continue building our network across the Association of Minnesota Counties. We leveraged that and really partnered with the state of Minnesota, then known as the Department of Human Services, now known as the Department of Children, Youth, and Families, so which are a little interchangeable, but the agency of reference will be the DCYF moving forward in the presentation, and came together in 2023 to collaborate on a policy ask that would help sustain this work with state investments. Notably, at that point in time, Minnesota had about an $18 billion surplus and had a trifecta of Democratic leadership. Now, you would think with an $18 billion surplus that there would have been an appetite to fund this more than what we were able to secure. But really, as you'll hear from the state, we were in an infancy in that we were doing a lot of proof of concept or evidence collecting around this model and the value that it held. And so at that point in time, we really didn't have a strong body of work to suggest and show lawmakers that this work was worth investing in and sustaining. But what we did come out of that session with $7.1 million. It's one-time funding and can be utilized through 2027 in a granting structure. And so we are currently within and working with our Department of Children, Youth, and Families in the hopes that they will continue to fund both family resource centers and full service community schools and community hubs. What you'll hear shortly from Yvonne Goodsky, who is the Deputy Director of Prevention Services with the Department of Children, Youth, and Families, and their lane really and how they tested this with the preschool development grant was related to community hubs, which are different than family resource centers, but we view them on a continuum of how we might support communities and families that are wanting to do this work alongside the state, counties, and our partners. Notably here too, which is important, we are undergoing a lot of change in the state of Minnesota, both from a policy perspective and in 2023, we had a new state agency authorized that I noted a little bit, is the Department of Children, Youth, and Families, or DCYF. We have just started the official transition in July of 2024, and that transition will end in 2025. But with that, there is really an entire state agency that is dedicated to serving children, youth, and families. And so there is an opportunity also to look at how we've been doing this work in the past, look at how we've supported it, look at how we've funded it, look at the collaboration across counties, state, our tribal nations, and our community partners and our families, and really think about government differently, think about community differently, and how we've entered this work with the Association of Minnesota Counties, again, in partnership with the Sauer Family Foundation and with the leadership of Scott County, is really how do we decenter government? How do we make this model sustainable through any political party and their leadership? And how do we really center on lived expertise in communities and elevate their leadership as a way to learn from them what they need and how we can better support them as a leadership model, both at a state level and at a local level. And so I pointed to, and I think it's worth noting here for sure that Minnesota faces some of the worst disparities as we think about our child protection system, both with African American youth and families and with Native American youth and families. And so all throughout this work, again, it is how do we decenter government? How do we listen to families? How do we elevate their leadership in this? And really, how do we leverage community-based supports, elevating the protective factors to strengthen families and communities and reduce the disparities of who we are seeing within our child protection system, knowing that our child protection system is not the place where the families are better served in many respects in a different place if we can avoid the child protection system and deeper end services. And so with that, I'm going to now, I believe, turn it over to, And here we go. Here's another slide, which I think really sums up what we are trying to do around addressing disparities. And it is the cultural navigators that bridge services with community partners and families. It is an integral component of our training, of our fidelity, of our work with communities. Parent advisory councils, that is a gold standard of each county and the community partners that are entering into this work. And then really, how are we, again, learning and leveraging the work of family resource centers to learn about what the needs are in concrete supports, making easier referrals to housing, transportation, childcare, and other services that we know have a correlative or have a correlation to involvement within child welfare and child protection. And really, again, the community leadership with government stepping into a partnership role and being decentered in the work. And I believe at this slide next, I have the distinct honor, Yvonne Goodsky is the Deputy Director of Prevention and Operations within the Child Safety and Permanency Division within the Department of Children, Youth, and Families. And we have a taped message from her, and then I'll come back around and provide some context on our next steps.
And I'm one of 2 Deputy Directors of Child Safety and Permanency at the brand new Minnesota Department of Children, Youth, and Families. I've worked for the state for almost 10 years, and my previous roles include Deputy Director of the Office of Indian Policy and Program Manager of the ICWA unit. I'm happy to be here today to share a little bit about our work. The state of Minnesota is working toward a whole family approach in which we work toward the well-being of both adults and children. Within these efforts, we are working to focus on supporting community-driven approaches that promote family well-being and build protective factors. State agencies, including DCYF, are employing numerous strategies across state agencies to focus on promoting family and community well-being to eliminate disparate developmental, economic, educational, and child protection outcomes. In 2019, multiple state agencies embarked on community engagement strategies to support the Preschool Development Grant and the Title V Needs Assessment. Between these 2 strategies, we learned a lot. We learned that families, especially families experiencing inequities, feel that they don't have access to the supports that they need. And even when they find access to programs and services, the practitioners or the service itself is not culturally responsive. Using $6 million of federal preschool development grant funding, we developed community resource hubs. Over 2 years, we funded 12 grantees across the state and enlisted 1 unfunded collaborative partner, Scott County. During the 2-year implementation period of the PDG hubs, we were able to provide all navigators with training and technical assistance on 3 important navigation, eligibility, and application tools: Help Me Connect, Bridge to Benefits, and Minnesota Benefits. And I'm including those links here in the chat. We were also able to provide trauma-informed mental health and consultation for navigators. This is a type of group reflective practice that provides a space for navigators to talk about their own struggles so that they can better serve families that come through the door. Finally, we offered quarterly network meetings for hub administrators and navigators, as well as bi-monthly communities of practice for navigators. These meetings allowed for continuous learning, networking, and feedback looping for all partners. Over 2 years of implementation for the hubs and partnering with Scott County, serving over 14,000 families, we learned a tremendous amount. First, families came to the hubs looking for basic needs. 2, navigators believe the mental health consultation along with bi-monthly communities of practice help them build networks and learn from other navigators. 3, navigators need community partners. And lastly, continuous engagement and feedback loops help define barriers to services at all levels and practice and policy solutions to those barriers. I'll put the link to the final evaluation report in the chat for folks who want to learn more about that. We considered hubs a successful proof of concept to help move us forward. During our 2023 legislative session with the partnership of the Minnesota Association for County Social Services Administrators, we proposed funding a network of community resource centers to focus on promoting community and well-being. Because the proposal built on the success of the hubs, FRCs, and full-service community schools, we use the term community resource centers as an umbrella for any organization that focuses on service navigation and provision of services and supports. We received $7.1 million over 4 years. Due to the similarity of services, we have tied CRCs and Kinship Navigator together into a singular RFP. The goals of CRCs and Kinship Navigator programs are to: 1, make it easier for families to get what they need; 2, increase community connection to families; 3, build the capacity of organizations and communities experiencing inequities to create access to programs and services that support economic stability and family well-being; and lastly, to promote practice, policy, and systems change at the local and state level to better support family well-being. The RFP for CRCs and Kinship Navigator adds additional components, including a requirement for community-based planning and partnership, local parent and family advisory councils, a focus on protective factors with a requirement for distribution of flexible funding for families, and use of a case management data platform. We have a statewide community resource advisory council that makes recommendations on the development of the RFP, evaluation, and ongoing governance. The council meets bi-monthly. We expect grant awards to be finalized by mid-September. Thanks so much. We appreciate the time to talk about our collaboration, and I can't wait to share more as we move forward. Thank you. And I'm one of
And I believe I'm back. So I want to thank Yvonne and each of our presenters for the part that they've played in this presentation. I believe there will be some time for Q&A, so please feel free to put that in the chat as you need. And then I'm going to really, our hopes for the future is this next segment. And so as Colleen indicated, the Sauer Family Foundation, the funding is short-term and was meant as a startup. And so again, in working with the state, we continue to look for opportunities for sustainable funding, either from a state investment or with other nonprofit or community-based partnerships. We are one of the components of the advisory council, as Yvonne mentioned, is to make a recommendation on a governance model. And so that might look like another entity where all the work that the Association of Minnesota Counties and largely Brenda has done might shift it to a different container. So again, we are able to realize the model of decentering government and government stepping into a partnership role instead of a driver or a leading role. And so that is continuing to be in an exploratory phase. Ultimately, what we also hope is that the work of community hubs, of full service community schools and family resource centers will push our state to really develop a comprehensive vision for prevention work, and that all can exist on a continuum and be funded appropriately, knowing that each community and each city or township or whatever locale may need or see themselves differently in that continuum, but so that our state picture and that comprehensive vision is able to support each of those components. We continue to do education with our legislators, with our state agency officials, with our community, with our county commissioners, which we have 87 counties in the state of Minnesota, and each county has between 5 and 7 commissioners. So we're doing education almost nonstop around the benefits of this model. Ultimately, again, we want to see it be sustainable. And part of that sustainability is to also build a stable foundation for our workforce to begin to actually realize prevention work, and so that we have a stable foundation to implement policy changes moving forward. And we learn more about what the needs of community are in real time so that we can direct resources that way. And we can say to our county commissioners or state or federal whatever policymaker we're talking to, these are the recommendations for sustainable funding, and really better understand how the blended streams of funding might operate at a local level through family resource centers. And then finally, throughout all of this, again, it is really core to how we do this work is elevating community and lived expertise as leaders. And this bears out, we have a lot of exploration still needed with our tribal partners. They've expressed a lot of interest. We have 11 sovereign nations in the state of Minnesota and a very strong and concentrated urban American Indian population. And so we know there's a lot of historical trauma and a lot of reparative work that needs to be done, but interest in this model, we think could be a way to begin to do that work and to get a little closer together. But it will take time and a lot of exploration as a model. And so I want to thank the states. I think we've learned from Wisconsin and maybe California and how they've done some tribal work. And then key and really, again, important as a next step is the data and evaluation. From a county perspective, and again, building off of Scott County's experience, it's not the total picture, but we have a strong interest in watching our child maltreatment rates, our out-of-home placement rates in this work as we think about the protective factors. And so really wanting to learn and see if the Family Resource Center model is a way that we can reduce the impact and involvement of child protection while also increasing protective factors, among other indicators that we'd like to keep an eye on, and also view this as an area of collaboration with our state partners and our tribal partners as well. And with that, I believe, politics are always key. Minnesota's in the spotlight. And so I think we're going to go after and ask for some additional funding, this next go around, but we'll need to continue to sustain that work. And so please check back in with us as you're able. And I just, again, want to thank the presenters here today and specifically the National Family Support Network for their continued support and guidance as we've entered into this space. And with that, the next, and lessons learned, it might help if I took a look at my slides instead of going off script. But what we've learned so far is the value and power of communities coming together on behalf of families. Again, Scott County is a beautiful model. There are many other initiatives that are very similar to FRCs, even though they may not be called FRCs specifically in the metro area, Ramsey and Hennepin. So we're really excited to see what that we think there's a lot of promise in working closer with those organizations. We've relied heavily on technical assistance. And so thank you again to NFSN. Early focus on model fidelity and training. I think maybe a couple points that we haven't shared is that within, as Brenda said, we expected 3 counties to kind of raise their hand and say we're interested. Right now at 26 and 18 months. That is a lot. And so as part of that movement, Brenda built out a leadership steering committee and really works hand in hand with them to kind of test concept, test beliefs, test kind of next moves, and then view them also as a way to kind of build in some of that fidelity. What are the training needs? How do we need to support the workforce in doing this work? Because it is newer work in the state of Minnesota as we shift our system to prevention. And really a continual feedback mechanism and structure, which is the steering committee. And then we also hold monthly meetings and bi-monthly meetings based on topics that have been identified by the steering committee and the network in conjunction with NFSN and their leadership. And next slide. Sustainable funding as a priority from the beginning. So we've always talked about and been very transparent with our network that the Sauer Family Foundation is short-term funding and will not sustain the network over however many years we are in existence. And so whether that comes from a nonprofit entity, our state partners, our federal partners, if we can dare to dream, and what that looks like, but we always need to keep an eye on that sustainable funding so that we don't overpromise to a community and then have to step back because we aren't able to do that. Informing and collaborating with local leaders and state legislators. Again, this is the education. So county commissioners, county administrators, state lawmakers, our governor, our children's cabinet. And so we are always doing that work and elevating the experience of individuals and elevating the experience of communities and the promise that we are already seeing. aligning the vision and work with both local communities and state departments, which again gets to that comprehensive prevention continuum picture. And the voices and stories of parents matter and is the center to the work that we do, because if we aren't making an impact and strengthening communities and families, then really why should we exist? And so with that, I believe I'm the next slide. We are turning it to the beauty. And I'll let her, she'll take us home.
FRC. I like to play in the kitchen area. I like to do activities. I like to take in and look out for the things in the FRC. I love to go to the FRC. And which day are we going?
So Marguerite, that was her son, and she was featured in the Scott County segment earlier. I don't know, Suzanne or Brenda, would you like to say a little bit more about Marguerite?
Sure, I can talk. Actually, Marguerite was invited to participate today, but was unable to join, but certainly gave us the permissions to share the video that she and her son put together. She immigrated here from, I believe, Peru, and had some marketing work in her home country, and was gracious enough to put this together and share this with us, really because of the impact that FRCs have had for her and her family. So we're just really honored to continue our work and partnership with her and her family and the rest of our Parent Advisory Council members.
Well, thank you all so much for being here today and for presenting. And just so thankful for the opportunity to hear your story in Minnesota and about where you started and where you're headed and all of the lessons learned along the way. Just fabulous. So thank you all so much for your wonderful presentation. As a reminder to take a moment to enter any questions that you have into the Q&A portion of the Zoom webinar platform. We'll look for those there. And you'll also see that there's the link in the chat for the handouts that were mentioned. So those all can be found in that Dropbox folder. As you're thinking of some questions, just want to share some upcoming opportunities that are available to you through the National Family Support Network. The first is our Webinar Wednesdays, which you know about since you made it here today. But just want to mention that in addition to the live webinars, we also have a plethora of webinar recordings that you can access anytime. So you can access other networks stories in that folder. There's all about the standards implementation, family resource centers that are serving particular populations. Just invite you to dive into that as you're able. They're all free. They're all available live and recorded. So encourage you to check those out if you haven't yet. Some other resources that may be helpful for you as you are on your journey. We have on the NFSN website some different resources both for FRCs and FRC networks. So there's there's FRC overviews and research reports, sample RFPs, evaluation plans, videos, information about data management systems. You can see here on the right of your screen a snip of a member network snapshot, which gives you kind of a high level overview of each of our 41 member networks at the NFSN. So a really easy way to get a brief understanding of each of the networks. You can access that on our member page, and you can navigate to each of the individual states and hover over it to see their snapshot. And of course, the standards of quality for family strengthening and support. I know Minnesota shared that that is part of their journey and part of their instilling quality in the foundation of their network. The standards are available to everyone for free. So if you haven't heard of those yet, check them out. We also offer a certification training on the standards. Some states, depending on where you are, may be offering the standards training. So you may have trainers already in your state where you can connect with them to receive the training directly from the state network that you're in. And if your state does not yet have trainers, you can participate in an open training that's offered by the National Family Support Network. And you can see the August one is filling right up, and you can still register this week. And we're also have open registration for the fall ones as well. We have another exciting opportunity available in the fall, which is our 2024 National Forum. So this is a really exciting event where you have an opportunity to hear from family resource centers, family resource center networks, how we are advancing the work. And you'll hear from some different some policymakers, and just a really great opportunity to come together and learn about the advancing of the field. So you can register for that on the NFSN website as well. That is free also. And coming up just in a couple of months is the International Virtual Conference, the Together for Families Conference. And this is kind of our big tent conference where we have content for program level, network level, policy level, everyone in between for the family support field. The content particularly related to the standards and family resource centers. We have 4 different tracks. You can learn about those more on the website. And perfect timing, today actually is the last day for early bird registration. So if you haven't already purchased your ticket, you can save $50 by hopping on and doing that today. So wanted to share that with you. We also have 2 hubs. We talked about family resource centers and family resource center networks today. We hope that both of these hubs might be useful to you on your journey. And these are both a compilation of both NFSN templates and documents that we have collected from member networks, such as the Minnesota Network, that can be used as really strong examples of FRC networks and funders of FRCs. So there's a couple different sections. One is the network tools for FRCs. So this is for the networks that are needing some tools to serve their family resource centers in their networks. So FRC identification surveys, FRC evaluation frameworks, lots of goodies in there. And then there's network tools for networks. So these are tools that are actually going to help you run your network. So membership agreements, network job descriptions, things like that. Some resource services that are available to you through the NFSN as well is just the opportunity to facilitate connections to NFSN member networks. We also are available to present for key stakeholders in your state. So maybe education leaders, child welfare leaders, children's trust funds, any public-private funders about working with and investing in family resource centers. We also are available to provide technical assistance for Family Resource Center network development. I know this, as the Minnesota Network had shared, this is a very key part that has really helped advance their network. They mentioned a couple of the names that have been really essential to them, and in our NFSN staff and contractors that we work with, there's several folks that we can leverage depending on the type of work that you're needing, the type of support that you're needing. So we would love to connect with you and learn what technical assistance you may need in your state or in your organization. You can learn more information online, and you can also set up a complimentary consultation as well. So be sure to check that out. We have trainings available too. I mentioned the standards one. We also have the Developing and Sustaining Effective Parent Advisory Committee training. We'll be launching this fall the new Connect with Effect outreach training, which we're really excited about also. So stay tuned for more offerings, but wanted to share those things so you'll have more tools in your tool belt on your journey. And here's my contact information. So I'll put that up real quick. And if you have any questions at all, last call for questions. I know that everyone was so thorough in covering the journey of the Minnesota Network. So just really amazing job covering everything. And if you can't think of any questions right now, that's okay. We had shared the Minnesota Network's contact information, and you have ours. So feel free to reach out anytime. And just really happy to make those connections. Again, the recording of this, the handouts, and all of the materials will be available on the NFSN website by this time tomorrow. And just checking to see if anybody entered any questions. I think just one question that would love to hear from whoever would like to weigh in. Just would love if there's anything that came to mind. I know you all put so much work into these PowerPoints and all of your different points. If there's anything else that maybe came to mind as you're presenting that, like, oh, hey, this might be really helpful for a network as they're getting started. Do you all have any advice that you would share to newer networks that are just getting started? You know, sometimes newer networks, as they're coming aboard, as they're hearing from networks such as your own, it can feel like, you know, wow, this is a lot, and like where to start, right? Or really any tips or anything. I think your lessons learned and what you shared were already so helpful, but if you have anything to add, would love to invite you to share.
Yeah, I will jump in here and say what I think has been a key success indicator for us is that this leadership team meets on a regular basis and has a really strong relationship and is pretty cohesive. And so we are always holding a space where we're thinking about where we've been, thinking about where we go, and what needs to happen in real time, and like what are the needs and demands of the network and our members, and being able to trust each other and also we do a pretty good job of clarifying whose role is it, who's got it. If somebody needs to take a vacation, somebody steps in, which has been invaluable as I'm lobbying at the Capitol, as Suzanne is continuing to say, hey, our site is, maybe 3 years old at this point. These are the rubs that we need to get ahead of. And then Brenda's got an immediate line to here are the 26 counties and here are the different needs kind of along the way, and communicating all of that with our current funder and with our legislators so that we're building what we need it to be, with our state agency partners as well. So this team is dynamic, and we need each other to sustain the work because it's not all roses every single day. And we get a lot of power and strength and vision from this team.
Yeah, I think the only other thing that I could add too, absolutely what Angie said, but also the strength that we get from all our members, from all those other counties and their partners, and listening to their stories. And their stories are really what I think motivate us and keep us going, just as Suzanne shared some, or Marguerite talking and listening to her when she talked to the county commissioners. It's all those parts that really energize us and energize those county leaders to say we really need to invest in this. And the other advice as far as a network starting is take it step by step. I think sometimes we can get lost and there's so many things that we want to do, and we just have to sometimes slow each other down and say, okay, we're really okay where we are right now. The rest will still come, and that we need to keep some faith that it will all work out in the end.
Excellent words of wisdom there. Thank you so much, Angie and Brenda, for sharing. I appreciate that very much. And so with that, just want to thank the Minnesota Network again for being here and for sharing their incredible story, their journey. We appreciate you all participating. Thank you so much for being here and participating in the webinar. As a reminder, a brief evaluation will appear on your screen when you exit the webinar today. We really appreciate your feedback on this evaluation. We use your input. We reread every word, not just saying that, to plan for future webinars. We've begun planning for 2025 and what offerings we may be bringing to our Webinar Wednesday series series. So really appreciate your taking the few minutes to fill out that evaluation. So thank you again, Minnesota, and hope you all have a lovely rest of your Wednesday. Thank you so much. Bye-bye.